face down a little bit. All right, that's good. That's good. I just want the round belly, right? Okay, so there's, it looks good. Okay, I don't see anything that jumps out at me as no big scars, no big discolorations, no anomalies like a swelling here or a swelling there. Okay, I just want to eyeball it because I can't feel that through the shirt. I can't see a bruise. Okay, you pull this shirt up. I had, oh, Julie, Mitch. Client comes to me with back pain. Man, about he's 57 years old, male, a little bit overweight, real big, burly, strong kind of guy. Said he hurt his back on the tractor. Okay, and could I help him? I was like, oh, okay, Mitch. You know, I said, let's do it. And so I put him on the mat, and he was. I'd worked on him before. Okay, and got to this point in the session. We're just doing a general session. I was going kind of easy because he was very sensitive. I pulled his shirt up. It was black and blue. Black and blue, right here, all the way from right here, wider than my hand, wrapped all the way around, and in the back it was puffed and distended with blood. And I was like, oh my God. And I go like this. Okay, Mitch, here, let me help you sit up. And I go, Julie, go get Terry, his wife, they were chatting in the other room. Terry comes and I go, okay, listen up, guys. So I'm going to say this really clear. Mitch, I'm so sorry. I'm not going to be able to help you right now. And the reason I can't help you right now is because right now I need you to go to the emergency room. I need you to go now. You have internal bleeding and you may have hemorrhage, the lining in one of your organs. And you need to go right now. We need to get you to the hospital right now. Terry, you're driving Mitch to the hospital. Okay? And sure enough, when he had the impact, which strained his back on the tractor, he turns out, he didn't tell me, fathead liar. He forgot to tell me that he was on blood thinner.
Yeah, he didn't think it was important.
Didn't think it was important. He was on blood thinner. So when he tore the muscle, it never stopped bleeding. And he had lost virtually a critical amount of blood by the time we got to the hospital. Critical amount of blood, right? Now, I couldn't feel that bruise. I could not feel the bruise. But as soon as I pulled his shirt up, I was like, oh my God. That's not good. Okay, that is not good. Okay?
Had you been doing rotations and shoulder stands and stuff with him?
No, because someone who's just injured their back, you don't take them into a rotation and shoulders.
Actually, I think it was you were working on Terry first, and then he became not so well and thought he'd get on the mat.
Yeah, actually I did. All right, so here we go. So I'm going to do my 10 circles. It's positive contact. It's okay to pick up some skin. I just don't want to have so much pressure that it's going to burn and drag, but I don't want to be so light that it's going to tickle and bring up too much sensitivity, right? I want, it's that 3 bears thing. I want it just right. Right? Now from there's my circles. Turn in, face the head, lay your hands gently, and guys, if you're not used to working on the abdomen, I've noticed that when we're practicing our flows, you're still kind of rough with each other, that sometimes when you go to get in position, you kind of beat and bang up against each other, that sometimes when you go to work that first point, you kind of jab into that first point a little bit, and sometimes when you go to do the twist or rotation, you kind of go hard when you do it, and it's kind of abrupt. Okay, guess what? None of that flies on the belly. China shop, right? Bull, China shop. Get that. Approach with caution. Everything's breakable. Okay? Everything's breakable. So when you're in this space, please don't get in a hurry. Don't go hard. Don't be abrupt. Really have your breath working for you. Really be gentle and loving and pay attention. And if you do that, we'll be able to practice. If you don't do that, we will not be able to practice because somebody's going to put up a red flag and they're going to go, the next person who touches my stomach, I'm going to punch him in the eye. Okay? So let's don't go there. Okay? Just saying. All right. So I lay my hands in here. I'm not on the bone. Okay, this won't work. And if you're a big guy working on a small person, or a woman working on a child, okay, in other words, your hands don't fit. In other words, sometimes I've worked on people who are small, so much smaller than me, that when I did this, I'm on top of the ribs, you know, and I'm on top of the pelvis, because my hands just don't fit, okay? So what you do is just cup your hands slightly, make them a little smaller. Just kind of get in there, all right? Now, start with the wave, roll. Hear that?
Good.
Right away. Hear that? You're going to feel stuff moving. You're going to hear stuff moving. And that's just an indication that I'm moving some fluid. If you have constipation and or diarrhea, it's pretty interesting. It works with both excess. This is a really good treatment for constipation and or diarrhea. Excess either way. It's a really good treatment. They operate from different mechanisms, but for some reason this treatment seems to be effect on either extreme. Okay, after I do my wave, turn in, and again, here's an opportunity to bump her, right? If I just kind of bang my knee up in, I really don't want to do that. I want to be up against her. I don't want to bang up against her, okay? All right, my 3 points, if I can look again, see it's here, here, and here. See how there's some overlap because my hand's big compared to her size of her abdomen. So I can't go 3 complete widths of my hand and still be on the belly. So I just allow for the overlap. The high point is as high as you can get without being on the ribs. The middle one, that's easy to get because that's even with the navel. And the bottom one is as low as you can get and not be on the pelvis or the pubis symphysis, okay? So we're gonna go here, push in, nice and easy. And it's go to the first bottom. There's actually more than one in the abdomen. So that first place where the abdomen says, whoa, Nelly, that's as far as I want you to go, okay? And then let go, jump over the fence. That's that center line. Somebody hand me a pen. Eat that, Joe's. Okay? No. All right, so there's the pen. So what I want to do is I want to push in and I want to jump over and come back on this side, and then I want to project in on this side and jump over and pull back on this side, and I want to project in on this side and jump over on this side, and I do not want to touch the pen. Okay, that's the fence. Do not. That keeps me from doing this. This is wrong. In this motion. So we don't want to roll once we're deep. When we're trying to work deep in the body, we don't want to work also transverse. It's either transverse at the surface or deep in the interior, but right now we don't want to do both yet.
Why?
Because it could create an injury, and you're not sensitive enough to know what's going on inside. You may not even be able to identify what you're working on, and it's just a practice. Right.
Before you start working on it, if you notice that redness that you were describing with an enlarged appendix,
Yeah.
and you said you don't work on the abdomen in that case, do you work on them at all, or do you tell them
Oh
to go
no,
to the
I ask them,
doctor,
do you
or-
know that your appendix is enlarged? And if they say yes, I go, well, what did the doctor say? And if they say, I haven't seen a doctor yet, I said, well, I suggest you go now. Because you don't know. Some people, maybe that appendix only enlarges to the size of a walnut before it bursts, and others it goes to the size of a grapefruit. You don't know where they're at. And the rule is, if you can identify that the appendix is enlarged, do not put any pressure at all. And I mean no pressure, because even bending over can put pressure on it. Tying your shoes, bending, doing a forward bend, doing a dhanurasana, puts pressure on it. You want no pressure on it, because you need to see, is it pathological or not, and does it need to be removed?
And is that the
Okay.
kind of situation where you might offer to actually drive them right then, because they maybe shouldn't be doing it themselves?
Personally, I like to ask people if they have a ride, okay? Because otherwise, I always feel compelled if I take you to the hospital, I always feel like I have to stay. And, yeah, go
I
ahead.
have two questions. One, can you do that on someone who's pregnant?
Yes, you can.
Okay, my second question is.
And actually, pregnant women love belly work. Love belly work. Go
Okay, my
ahead.
second question, when I laid on the mat, the first time you touched me like this, I
Yeah.
had a wave of energy go down my right leg, and then when you
Yes.
tapped on me, I had it go down my left leg. What
Yes.
does that mean anything in particular, or
No-
just that I'm feeling the
Nothing
energy?
specific, but please be aware, it may surprise you. If you haven't been having a lot of abdominal work, it may actually just shock you how much energy or movement you'll feel when you start getting this work. It might just shock you. If you've been getting a fair amount of abdominal work and you've been working on your abdominal focus, okay, maybe not. You know, you may not feel anything, okay? But certainly, if you're not used to it, be prepared. And now, here's the other thing. If you start to feel emotional while you're getting the work, or while you're doing it even, because sometimes, back to this, okay? Remember the surrogate testing? Sometimes when I'm working in the abdomen, I have sensation in my belly, okay? That's telling me something not about me. See, that's the mistake. Think that stuff came up for me while I was working on you. Well, no. Once you understand surrogacy, the way that works, it's empathy, and it's a sympathetic resonance. It's your body's innate is actually communicating something about the client. Okay? Later we can talk about what it might mean, right? But if you start to feel very emotional, what I want you to do is this, because I don't want to spend the rest of the day in a big cathartic release with half the class. Okay? What I want you to do is tap the person who's working on you and just tell them, just hold up a minute, okay? And I want you to, take a breath and pull yourself together, okay? Just take a breath and pull yourself together. This is not a treatment, and I don't want to pursue it as if it is, okay? Just because it's not what we're doing right now, okay? All right, partner up and just do the first part of what I showed you. Really